Methemoglobinemia can be acquired or congenital. It occurs when the iron in hemoglobin is oxidized from iron plus 2 to iron plus 3, leading to poor binding of oxygen. Additionally, the oxygen that is already bound is held more tightly to the hemoglobin due to a higher affinity, resulting in less oxygen delivery. A meth hemoglobin level greater than 1.5 gram deciliter causes cyanosis. The most common congenital cause is a deficiency in the enzyme cytochrome B5 reductase, which reduces meth hemoglobin in the blood. However, in infants, the most common cause of methemoglobinemia is acquired through the ingestion of nitrates through well water or foods. Nitrites produced by the microbial reduction of nitrate directly in the drink water or after ingestion by the infant in his digestive system are more powerful oxidizers than nitrates and are the chemical agent really responsible of the oxidation of iron plus 2 into iron plus 3 in the tetrapyrrole heme of hemoglobin. Infants younger than 4 months are at a greater risk given that they drink more water per body weight. They have a lower NADH cytochrome B5 reductase activity, and they have a higher level of fetal hemoglobin, which converts more easily to meth hemoglobin. Additionally, infants are at an increased risk after an episode of gastroenteritis due to the production of nitrites by bacteria. The sources of nitrate can include fertilizers used in agricultural lands, waste dumps, or pit latrines. For example, nitrate levels are subject to monitoring to comply with drinking water quality standard in the United States and other countries. The link between blue baby syndrome and nitrates in drinking water is widely accepted, but as of 2006, some studies indicate that other contaminants or dietary nitrate sources might also play a role in the syndrome. When diagnosing blue baby syndrome, it is important to perform a thorough history and physical exam. When obtaining the history, it is important to determine the timing of symptoms and to ask about risk factors exposures, such as prenatal history or access to well water. We do not encounter necessarily this kind of a pathology only in Africa. We have here a scientific article from Japan, and this is a recent topics in public health in Japan 2023. Recent water quality incidents and a methemoglobinemia outbreaks in infants due to inadequate plumbing of a university hospital's private water supply. And if we look at the article itself, because there are other topics in this article, we come to number 4, the outbreak of methemoglobinemia in a hospital. A chemical incident occurred because of a cross connection in a building. On October 19, 2021, methemoglobinemia developed in 10 of 17 infants in the neonatal intensive care unit of Gunma University Hospital in Mabashi, Gunma, Japan. It was found that these infants had been fed milk that had been prepared in the kitchen on the first floor of the same hospital building, and it was suspected that the event was caused by nitrite in the water used to prepare the milk. Treatment was immediately initiated, and fortunately, the incident did not become more serious, but normal operations of this hospital had to be suspended because water was supposedly contaminated. In methemoglobinemia, the hemoglobin in red blood cells change to abnormal methemoglobin, causing the skin and mucous membranes to turn blue. It is also called a blue baby syndrome because the whole body turns blue. These symptoms are caused by the ingestion of nitrite or nitrate. Many cases of methemoglobinemia have been reported worldwide for a long time, mainly in European countries and the United States. In 1996, a serious case of cyanosis in a newborn baby due to nitrite of 36.2 milligram NL as nitrogen concentration in the well water used for preparing bottles of infant milk formula at home was also reported in the North Kanto area in Japan. The hospital conducted a water quality survey and found that the nitrite concentration was abnormally high, up to 490 milligram NL, exceeding the DWQS by more than 10,000 times higher in some points. Because of the abnormal water quality, the water was supposed to be from the exclusive water supply system of the university hospital, hereinafter referred to as tap water, which is produced by treating groundwater within the facility. The City Health Department and hospital conducted a water quality survey and found that the water quality abnormality was limited to the tap water in the North Building. The North Building includes outpatients and inpatient area, a dialysis room, and a kitchen where milk for the newborn room was prepared. The hospital organized an investigation committee in which the author was asked to participate as an external expert. And this is the conclusion of this particular fact that has happened in that hospital. In SPOWS, which actually stands for Specified Privately Owned Water Supplied, incidents such as cross connections, aging facility, and accidental water contamination are likely to occur. Recent accident cases are summarized. As for the outbreak of methemoglobinemia at the University Hospital, it was caused by the backflow of nitrite in the anti-corrosion agent in the water for air conditioning due to cross connection. Hydraulic calculations also showed that backflow can occur from air conditioning water. We must be extremely careful about the inadequate piping in facilities, especially those related to medical care. We have found a very effective herb to treat this particular pathology, and we encourage you to inform yourself regarding this herb, which is called Ngoka, and it is available at our health center, and it's also available by different suppliers. The one we use is from Back to Eden. This is again another example of how we can use effectively after having diagnosed the problem, and we can actually help people to regain their health without causing extra damage to the body. May we understand the validity of those beautiful natural remedies. We do not necessarily neglect the teaching and the diagnosis of specialists, and yet we know as well that herbs existed before any medication in pills or capsule ever existed. So we encourage you to look at both sides and develop the naturopath spirit, where like at the University of Loma Linda in California, this is what they have done. They have presented to their doctor both teaching, both training, so that they are both doctors and naturopaths. Because in some instance, you have to use the medicine, the medical side of the approach for pathology, but in other instances, naturopathy also works really well. So may the Lord bless you as you continue to bless not only the body, but the souls of the client that comes and the patient that comes your way. It's a very, very honorable work to be doctors and nurses and nursing aid and gospel medical missionary worker. May the Lord bless you.